Greetings from CMCS Health and Medicare Private Limited. Living donor liver transplant in India for end-stage liver disease patients. As deceased donor liver are not freely available for liver transplant, living donor liver transplant offer hope for end-stage liver disease patients. A healthy blood relative can donate part of their liver to save the life of a patient with end-stage liver disease. Name trust you can trust for your specialized medical treatment needs in India, CMCS Health. You can send your queries to us on our WhatsApp number, that is +91 9971 986258. Who can be a living donor for an end-stage liver disease patient? Most liver transplants in India are from living donors due to the lack of deceased donors. The donor must be a healthy male or female aged between 18 to 55 and a close relative of the patient. This is defined as the spouse, parents, siblings, grandparents, and children of the recipient. Any of them can be a donor if they are healthy, have passed all the tests, and comply with the requirements of the law. What are the requirements for being a living liver donor in India? The living donor must be in good general physical and mental health. The donor must undergo a comprehensive medical and psychological examination and must be fully aware of the risk of the surgery, and only then he can voluntarily become a living donor. Donor must have a compatible blood type with the recipient, must have a body mass index of less than 35. Donor must not have a heart or kidney disease. Donor should not be overweight because overweight people usually have a fatty liver. And donor must be of the same height and build as of the recipient. What happens to a living donor after a successful liver donation? A suitable donor can donate up to 70% of their liver without any complications. Within 3 to 6 weeks, the donor restores 100% liver functionality and begins to live a normal life as before the liver donation. There are no inconveniences or obstacles in the daily life of a living liver donor after donation. But thanks to their donation, a life is saved. What happens to a living donor after a successful liver donation? Typically, the donor stays in the intensive care unit for 2 days after the liver donation and is then transferred to a regular hospital room for another 3 or 4 days for observation. When a donor is discharged from the hospital, they are usually on their normal diet and begin their daily activities on their own. Donors do not need any lifestyle changes, dietary restrictions, or medications for a long time post successful liver donation. The only precaution to be taken by the donor is not to lift heavy weights or get strenuous exercise for 6 months post donation, as with any other normal abdominal activity. Surgery. A name you can trust for a successful living donor liver transplant in India with the best of the Indian liver transplant surgeons. CMCS Health is your healthcare consultant from India. You can send your liver transplant related queries to us on our WhatsApp number, that is +91 9971 986258.